Hey everyone, and welcome back to the channel. Today we're tackling a really important topic that's getting more and more attention: marijuana use during pregnancy. With all the changes in laws and attitudes, you might be wondering, is it really a big deal? Let's dive into what the science says. Pregnancy can be an incredible journey, but let's be real, it can also be tough. Morning sickness that lasts all day, constant worry, and hormones that have you crying one minute and laughing the next. When you're feeling that desperate for relief, it might be tempting to think about using marijuana. But before you do, let's talk about why experts are urging pregnant women to just say no. You might be surprised to hear that using pot during pregnancy isn't safe. And you're not alone in that thinking. For a long time, the information out there was a bit confusing. Older, decades-old studies were often smaller and didn't use the most effective research methods. Because of this, they didn't really show a clear, increased risk to a developing baby. This led to a lot of misinformation and a general feeling that it might be harmless. But here's the thing: science has come a long way. Newer, much larger and more detailed studies are painting a very different picture. The evidence is now piling up, and it strongly indicates that marijuana used during pregnancy can put your baby's development at risk. The old ideas are out, and new, more reliable data is in. So what exactly are these new studies telling us? Well, the findings are pretty concerning. Research now clearly shows that when a baby is exposed to marijuana in the womb, there's a higher risk of several medical conditions. One of the most consistent findings is lower birth weight. Babies born with a lower birth weight can face more health challenges right from the start. There's also an increased risk of preterm birth, which means the baby is born too early. Preterm babies often need specialized medical care because their organs aren't fully developed. This leads directly to another finding: a higher rate of admissions to the neonatal intensive care unit, or the NICU. Having a baby in the NICU is an incredibly stressful experience for any parent. Another serious risk is placental abruption. This is a dangerous condition where the placenta separates from the wall of the uterus before birth. The placenta is the baby's lifeline, providing oxygen and nutrients. When it separates, the baby can be deprived of these essentials, which can lead to preterm birth or even worse outcomes. And the risks don't stop at birth. Studies have also looked at what happens after the baby is born. For moms who use marijuana and breastfeed, their babies might be more lethargic or sleepy, and they may not be as effective at suckling. This can make feeding difficult and impact the baby's early growth and bonding. What's even more alarming is what healthcare providers are seeing on the ground, especially in places where marijuana has become more available. In these areas, they're noting an increase in the rates of newborns with heart defects, neurological defects, and even Down syndrome. While more research is needed to fully understand these links, these initial observations are a major red flag. Now let's talk about the pot itself. The marijuana available today isn't the same as it was 20 or 30 years ago. Today's designer marijuana is often much more potent. It has significantly higher concentrations of THC, which is the chemical that gives you the high. And here's the crucial part: we know for a fact that THC crosses the placenta. It doesn't stay with the mother. It gets into the baby's system and reaches the baby's brain. This is happening during the most critical periods of brain development. Think about it. The brain is forming its fundamental structures, making connections that will last a lifetime. Exposing that delicate, developing organ to a psychoactive chemical has the potential to cause significant and lasting impact. The big unknown is exactly how much THC causes damage, or when the brain is most vulnerable. Is it in the first trimester, the third? We don't have those precise answers, and we may never have them, because it would be unethical to conduct that kind of research. So given that we know THC reaches the developing brain, but don't know the exact safe amount, if one even exists, the only truly safe approach is to avoid it altogether during pregnancy. So, what are the potential long-term effects? This is where researchers are still gathering data, but the early theories are concerning. There's a suspicion that marijuana exposure in the womb could lead to an increase in behavioral issues later in life, like ADHD and other learning deficits. These are conditions that can affect a child's ability to succeed in school and in social situations. We can also look at what we know about THC's effect on the adolescent brain for clues. An adolescent's brain is also still developing, although not as rapidly as a baby's in the womb. Studies on teens who use marijuana have shown that they can actually lose IQ points, and tragically they don't seem to get those points back, even if they stop using. It's logical to assume that if this is happening to a teenage brain, the effect on a much more vulnerable, rapidly developing fetal brain could be the same or possibly even worse. We just don't have enough long-term data yet to say for sure what it does to a baby's IQ, but the risk is not one worth taking. I know what some of you might be thinking. What if you're dealing with severe morning sickness, or debilitating anxiety or depression during your pregnancy? It's completely understandable to want relief. Many women are hesitant to take prescription medications because they worry about safety, and that's a valid concern. But here's the important distinction. Prescription medicines approved for use in pregnancy have been studied. We generally know their risks and benefits, and doctors can help you weigh them. They are generally considered a safer, more predictable option compared to marijuana, which is unstudied and unregulated in this context. Your doctor can work with you to find a solution that you feel comfortable with, whether it's a safe medication, therapy, or other coping strategies. Never feel like you have to suffer in silence, but also never accept marijuana as a natural or safe alternative. It's a tricky situation because the legalization of marijuana in many places has made it seem more mainstream and, by extension, safer. But it's so important to remember that legal does not mean safe, especially when it comes to pregnancy. The message from medical experts is clear and united. Stay away from pot during your pregnancy. This isn't just about heavy use. It applies to even small amounts. Your baby's health is the top priority, and for those 9 months it's best to be as careful as possible. If you're struggling, please reach out to your doctor or midwife. They are there to support you and can provide safe and effective ways to manage your symptoms. Thanks so much for watching and for taking the time to learn about this critical topic. If you found this information helpful, please give this video a thumbs up and share it with anyone who might need to hear it. Don't forget to subscribe for more health content. See you next time. This video is for educational purposes only and is not medical advice. Always consult your doctor or a qualified medical provider about any decisions related to pregnancy, medications, or substance use.